We are continuing our discussion on the coronavirus or COVID-19 pandemic. The Orange County Economic Recovery Task Force has made recommendations for how we might be able to return to some sense of normalcy, while local attractions have presented their plans to the county of what they'll do to keep their guests safe. So, what does that mean for you? On this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor Jerry Demings to give us an update on what's going on here in Orange County. Good morning, and thank you for being with us today, Mayor Demings.
I'm glad to be on the show once again with you.
So what is the latest going on here in Orange County as it relates to the coronavirus?
Well, we've had a very active week here in Orange County. An important week regarding the reopening of businesses here within our community. We had the opportunity to hear from the two largest theme parks that we have here in the area, that being Walt Disney World and SeaWorld, and last week we heard from Universal. But this week we have submitted an endorsement to the governor supporting the reopening of SeaWorld on June the 11th and Walt Disney World on July the 11th. And so that's monumental for our community because of the number of employees that each one of them has here within the area. In addition, this week we finalized plans regarding spending the federal CARES Act funding within our community, and we continued our efforts to do further testing for the virus within our community and provide personal protective equipment to our residents. Now, in terms of the virus itself, we have a low positivity rate here within Orange County. We are now at 2.8% of individuals who have tested positive within our community. All total, we have about 1,900 people who have tested positive for the virus out of some 67,000 tests that have been done within the community. So that relatively low positivity rate allows us to be able to reopen business gradually within the community. So this has been a very thoughtful and methodical process to reopening commerce here within our community.
And Mayor, you mentioned the CARES Act. What is the process for local businesses, individuals, and even social service organizations to access funding from the CARES Act here in Orange County?
Orange County received a total of $243 million in CARES Act funding. We have endeavored to spend at least 60% of that money on individuals, families, and businesses. So we have a business assistance program where we have now allocated $72.9 million of the $243 million specifically to assist businesses. We believe that we will be able to assist as many as 6,500 local businesses with grants of $10,000. They have to be an Orange County business, and they have to be a small business of 25 employees or less, and they must demonstrate that they have been negatively impacted financially by the shutdown of commerce here within the area. And then we have set aside $72.9 million for social services. Those dollars will be used to provide job training, as well as job placement, as well as mental health counseling and treatment, as well as other services, social services for families and individuals, for crisis assistance to assist with rent payments, etc., over a period of time. And so, again, about 60% of the funding is set aside for those efforts. The remaining funding is set aside to assist local governments to help prepare Orange County and its public safety to continue fighting the virus and stopping the spread of the virus within our community. And then we have about $25 million that we're putting in a contingency fund so that if we underestimate some of the needs and some of the other purposeful areas, we will receive direction from the Board of County Commission about how we will spend the remaining dollars. So that's good news for our community, because we are a community of more than 500,000 permanent residents. It made us eligible to receive direct funding from the federal government. Essentially, here within the metropolitan area, we're the only division of government that was allowed to receive a direct funding allotment from the CARES Act. The other counties, Seminole Lake, Osceola counties, have to really go to the state of Florida and advocate for the governor to provide a share of the funding that went to the state for their respective counties. So we're in pretty good shape, because we did receive, as I said, nearly $250 million in funding to be able to assist us with our response and recovery efforts.
And Mayor, there are two big concerns on the minds of residents of Orange County: jobs and housing. Where can people go to get more information?
Well, they can go to the Orange County website at ocfl.net and find out a lot of information about the various programs that we're offering, all of the circumstances that I just described to you. There's some collateral materials that are posted on our website that gives additional direction. In addition to the Orange County website, obviously at ocfl.net /coronavirus, ocfl.net /orange cares, ocfl.net /PPE. You can find information about all of that if you go to the website. But we're also sharing information through Orange TV, our public television network. We are also doing several times a week media briefings, and they tend to be well viewed. We're also communicating with the radio and television. I do numerous interviews really each day, as well as other county staff members who are sharing information with the general public. And then we also share information with our community-based organizations that we partner with. We are leveraging our dollars by partnering with organizations like Second Harvest Food Bank, the United Way, and the Homeless Service Network, and other social service providers here within our community, to ensure that we are being as responsive to the needs of our residents as we possibly can.
And what have you learned about the resilience of Orange County residents throughout this pandemic?
You know, I've learned much about the resiliency of this community. I've been a public servant for nearly 4 decades at this point, and had to manage through many different crises over time. And what I find through going through all of those crises, that we are a community that comes together whenever there's a disaster, a crisis, or other incidents that we have to overcome as a community. Not too long ago, just about 4 years ago, we had the Pulse nightclub incident in this community, and we had to come together and unite across really cultures, ethnicities, race, genders, to respond to the recovery from that incident. And so we came out of that crisis much stronger as a community. I believe that as we have gone through this pandemic together, we will come out of this pandemic much stronger than when we went into it. So we understand that we are a resilient community, and we do much better when we rely upon one another for our success.
Well, Mayor, we appreciate you being with us today, and thank you so much for the work that you do.
Glad to be on the show. I look forward to coming back again in the very near future. Stay tuned to all of the various briefings that we will do through media briefings, as well as stay focused on our website for additional information as we continue to recover from the pandemic.
And we'll be back with more. Stay with us. Let's get an update from our local medical professionals, and joining me is Dr. Yolanda Martinez from the Health Services Department for Orange County. Thanks for joining us, Dr. Martinez. Can you give us an update of what the latest is as far as coronavirus is concerned here in Orange County?
Well, thank you very much for having me. The latest update is that the cases have slowed down a little bit, so that's a good thing. But we also need to keep in mind that we can't let our guard down. Even though the cases are not as high or on a daily basis as they were in the beginning of the pandemic or the middle of the pandemic, it is important that we continue to be cautious, that we observe social distancing, that we wear a mask when we are approaching other individuals or in close contact with individuals, and most of all, hygiene, washing your hands, sanitizing surfaces.
So there are a couple of new testing sites from the county and also from the state that have opened up. Can you tell us about those new testing sites?
The Health Department, Florida Department of Health, continues to have their testing site at the Orange County Convention Center, and they're also doing their not only the oral swab but also the antibody testing. Orange County government just today completed testing at one of their locations at Mid-Florida Tech, but we will continue testing throughout the month of June. We will be also at Apopka High School and at Ventura Elementary, and we will still choose other sites. So there's still testing available for the community if they want to.
And you mentioned that people are needing to stay vigilant with their hygiene and also with social distancing. Have you noticed people becoming more complacent?
Yes, unfortunately I have. Going out, to the grocery store when I've needed to go out for that, and sometimes as I'm driving around, going from one location to the other from our testing sites, I have noticed that people have relaxed a little bit their behavior on using masks and in social distancing. And it is important that we pay close attention to that we remain vigilant, because as we all know, there's the possibility of a second wave. The virus is still out there, and if we're still under the possibility of a possible second wave, we need to be cautious so that our community doesn't fall harm to that.
And like you said, the virus is still out there. What are the numbers currently in Orange County? Well,
in Orange County right now we have over 1,900 cases. 1,902 to be exact as of today. We have 41 deaths, unfortunately, and these are cumulative since the beginning of the virus in our community, but still 41 deaths is more than what we would have wanted, and 309 hospitalizations, again, cumulative. When you compare it to other metropolitan areas, it doesn't seem as high, but it's still causing a damage to those family members or those community members that have been affected. And one of the things to keep in mind too is that from the beginning of the pandemic, the community leaders, our mayor and other community leaders made the decision to close the parks down and other areas that could have put us in a worse situation. So the fact that we have fared a little bit better than other metropolitan areas does not necessarily mean, as I mentioned, that the virus is not out there. It is out there. We've just taken extreme precautionary measures to reduce the effect in our community.
And one of the things, of course, behind the numbers is that people are getting tested. Who, in your opinion, who should get tested during these times right now?
Well, almost anybody can get tested now. Testing has become available beyond the CDC guidelines, and the CDC guidelines say that if a person has a fever or has any of the symptoms, that should be the person that should get tested. However, there are many testing sites. The testing sites that the county government is managing will take anybody that wants to be tested, not necessarily with signs, because we also know that there are people that are positive but do not have any of the symptoms. So I believe that almost anybody that has the ability to get tested should get tested, but primarily those individuals that might have symptoms, they feel they have flu-like symptoms, or that they feel that they have been exposed to someone who has symptoms or has been confirmed COVID-19 positive.
And the reason we say that people without symptoms should get tested is because they can spread the virus and be asymptomatic. Is that correct?
That is correct. That is correct. You can have the virus and still go through your life like normal and still spread it as you talk and the droplets fall, or you touch a surface by having touched your face or any of your, your mouth that could spread the virus.
Talk about the approaching hurricane season. How should shelters be handled, especially for those with special needs?
That is a very good question, and we have already started planning and thinking about the possibility of a hurricane hitting our area and having to open special needs shelters. Some of the things that we're keeping in mind or trying to look at is the possibility of either having to open more shelters. Traditionally, we open 3 shelters for special needs people. We might need to open more to be able to keep safe distancing, appropriate social distancing, and or find a larger location that will allow us to provide the same services, but keeping the residents at a higher distance from each other. Obviously, the use of masks, we are already stocking up and making sure that we have enough masks to be able to distribute, and hand sanitizer, and having hand washing stations is also important. So, and continue to educate the people, the residents that will need to use the shelters to please be conscientious of social distancing as they're moving around the shelter, and to wear their masks and wash their hands and sanitize their hands when possible.
Well, Dr. Martinez, thank you for keeping us informed from the front lines of this pandemic.
Thank you. Thank you for having me.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep you informed about the coronavirus, from local government and the medical community who is on the front lines dealing with this pandemic, and organizations who continue to serve the community. And we are also here to help you keep making those healthy connections. Stay safe.